Ophthalmology is the branch of medicine that deals with the anatomy, physiology, and diseases of the eye. Your best defense to prevent these diseases is to have regular checkups because eye diseases do not always have symptoms. Early detection and treatment could prevent you from losing your sight. See an eye care professional right away if you have a sudden change in vision, if everything looks dim, or if you see flashes of light. Other symptoms that need quick attention are pain, double vision, fluid coming from the eye, and inflammation. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned and keep your eyes open for Healthy Connections. Dr. Chirag Patel from Lake Nona Ophthalmology is here to begin our discussion. Dr. Patel, thanks for being with us.
Thank you very much, Annetta.
Let's start with the basics. What is the difference between an ophthalmologist and an optometrist?
Okay, that's a great question, and it's actually a question that a lot of my patients ask me all the time. And simply put, I usually tell my patients that there's three key providers in terms of eye care and eye health. The first part starts with, I'm going to add a word, an optician. An optician is someone who is trained in grinding lenses, making frames, and making sure that the lenses and frames fit appropriately. Okay. The next sort of level is an optometrist. An optometrist is a trained eye care professional who goes to optometry school after college, and what I consider them are primary eye care providers. What does that mean? When you have sort of a general complaint, a cough, a cold, you go to your primary care physician.
Okay.
An optometrist is generally is considered a primary eye care provider. So your routine exams, you know, an optometrist is great in getting you the right prescription of glasses, of contacts, and even seeing if you have any signs of disease and even treating sort of benign eye conditions. And an ophthalmologist,
which is what you are,
which is what I am, is a trained medical professional who is either an MD or a DO, who goes to 4 years of medical school after college. So the same colleagues who further go on to become radiologists and pediatricians. So we go to medical school, and then after medical school, we go through what's called a residency and perhaps a fellowship, and that's generally
like
about
any other medical specialty.
Exactly.
With the extended education. So what can you do that an optometrist,
Okay.
I'm confused myself. What can you do that an optometrist can't do?
Okay, so we generally treat complex diseases of the eyelid and the eyes, and so that ranges from, you know, droopy eyelids to cataracts to glaucoma or macular degeneration. And typically this can involve either medical treatments with either pills or drops, but a lot of times it involves surgical procedures or laser procedures.
Do people kind of ignore their eye health? We focus so much on other areas of the body, and it's kind of, well, I'll get around to it, or my vision's a little blurry, I'll just go to the corner drugstore and get some readers. Yeah,
absolutely. You know, a lot of times what happens, and I've had patients frankly tell me this too, is you take your eyesight for granted sometimes until something happens, until they get a severe inflammation in the eye, or something happens where they can't allow them to see, and it starts affecting their lifestyle or their career, and that's when they realize, oh wow, this is kind of important.
So when should you get an eye exam?
So the American Academy of Ophthalmology recommends at least a yearly eye exam, or every 1 or 2 years until you're about 40 years of age. And thereafter, it's really recommended to have a yearly eye exam thereafter.
And what happens for people who have never gone to the eye doctor, as most people call you, and they go, I'm just fine, I don't need to do this. What happens in an eye exam?
So what happens during an eye exam are, a couple parts. The first part is we as a physician want to see how well are you able to see. And so checking your vision without glasses and seeing if you need any corrective lenses to help you see as well as you can. The second part of the exam involves sort of evaluating your eye movements, looking at your fields of vision, seeing if the pressures of your eyes are within the normal range.
Now, when you say your fields of vision, what does that mean?
So we're talking about, are you able to see, how well are you able to see in your peripheral vision, sort of out here, okay? And that's something else that we sometimes take for granted, and that's a part of our vision that sometimes can be affected by glaucoma.
Okay, and we're gonna talk about specific diseases later, but let's say you have children. How soon should kids get eye exams?
Generally, most children do get a preschool screening examination, usually by the time they enter elementary school. And so that's generally a good time to at least get evaluated before they enter grade school. The other thing is, as a parent or a grandparent, if you're noticing any issues with the child itself, are they squinting a lot? Do they prefer one eye or another? Are they seeing that they have a particular head position when they're trying to look at something, either a head turn or a head tilt, or even crossing of the eyes?
Well, it's kind of hard for a child to tell you what's wrong because they don't have a basis of comparison like most adults do. Have you found a connection between a child's performance in school and how well they see? I know there have been...
Yeah, absolutely. Certainly I think that one of the first things I always ask kids are, when mom or dad says, I feel like he's not seeing well and his grades have recently dropped. And, one of the things I tell the parents is, when they're not seeing well, I ask them, where are they sitting in class? Are they sitting in the back of class? And depending on how we check their vision and how their vision sort of grades out, it certainly can make a huge difference.
And that's something I would suspect a lot of parents don't think about if they see a drop in grades, is whether my child can actually see what's going on in class.
Yeah, absolutely.
Are the treatments for eye problems fairly complicated or simple?
Well, I think that's...
I mean, glasses, of course, is the obvious
one. And I think there's a range. Certainly there are sort of benign conditions like either myopia or nearsighted, which is nearsightedness, which means you can see well up close without glasses, but you can't see really well far away without glasses. So that's nearsightedness, or farsightedness, which is the opposite. So you see very well far away, but up close becomes a little difficult. So those are fairly simple fixes with just eyeglasses or contacts, and even some diseases such as dry eyes. They can start off as very simple fixes by lubricating the eyes, but certainly as the severity of the diseases increases, the complexity in treatment also does as well. And
if you find you're constantly using eye drops, that should be, I would imagine, a sign you need to see a doctor. Yeah,
certainly. And for someone who is, I would say, a layperson who doesn't have much experience with the eyes, you go to a drugstore and your head starts spinning because there's hundreds of different, types of medications and drops that are out there, and certainly I can imagine it's very confusing to know which is the right one for one to use.
Well, when we come back, we're going to get a little more specific about the most common diseases of the eye that you see and how you can really get yourself into trouble if you don't heed those warning signs.
Absolutely.
We'll be right back. Stay with us. We're talking to Dr. Chirag Patel about eye diseases and treatment. When we left off, we were talking about the difference between optometry and ophthalmology and the most common diseases that you see in children and that sort of thing. But one thing I found surprising is that ophthalmologists also do some cosmetic things. Tell us about that.
So, you know, a lot of people forget to consider the eyelids as part of our specialty. And so the mid-face, which includes our eyelids and our brows, certainly are part of the eye-eyelid complex. And so drooping of the eyelids is certainly a very, very common condition that we remedy all the time with either surgery or Botox or those types of things.
So you actually do an eyelid lift?
Yeah.
Which is something we would commonly think that a plastic surgeon would handle.
Sure. And so that's sort of a territory that many specialties sort of take care of, including ophthalmology, ENT, even facial plastic surgery.
I have a feeling your phone's going to be ringing off the hook about that one. Let's talk about the most common diseases of the eye that you see, starting with macular degeneration. Define that for us.
So macular degeneration is essentially a disease of the macula, and the macula is the portion of the retina which is similar to the film of a camera. Okay, the retina is the film of a camera that allows and sends the signal to our brain that allows us to see.
Yeah,
and
that's in the back of the eye?
So the macula is in the back of the eye. It's sort of the wallpaper covering of the back of the eye, and it's responsible for our central vision. So
when you say central vision?
So what we focus with. Okay, so if you want to look at something, you're always looking at it with your macula. Okay, so that's your fixation point. And so a lot of times what happens is our body has a wonderful way of removing waste products over time. So whether it be our kidneys or our GI system, and as we go smaller and smaller on a cellular level, there's also a process of removing waste products. In patients who have macular degeneration, what we've found is that it's typically age-related and also has a genetic component, but waste products build up which allow the retina to start to degenerate over time.
So what would someone notice if they have macular degeneration? What would be different?
Sure. So what would be different are problems associated with your central vision, typically reading, okay? Crossword puzzles. The lines on a crossword puzzle are starting to be a little jagged or distorted. Words on a page are starting to sort of jump up and down maybe, or even just starting to see small blind spots in the center of your vision.
So is that easily treatable?
Well, you know, it's not curable. But certainly with good management and timely management, I think it's able to be pretty well treated and hopefully stabilized. And there's certainly a range in severity of the disease, but you know, it is a huge disease that's going to be, by the year 2020, a huge cause of blindness in the United States.
What about glaucoma? We hear a lot about that, but give us the official definition.
Sure. So glaucoma is a disease of the optic nerve, and the optic nerve is what connects the eye to the brain, okay? And the nerve serves to transfer all the information, the visual information from the eye to the brain. And so what happens is that what we've seen in glaucoma is that when the pressure in our eye elevates beyond a certain threshold that the patient can handle, and that's not something that the patient would necessarily know, the nerve, which has millions of different nerve fibers in it, start to drop out as a result of damage from the pressure in the eye.
And again, if we have glaucoma, what are we noticing that's different in our vision?
So this is the one thing I always key in on patients, is that glaucoma is a disease that can be silent for many, many, many years. And so you may not even have any symptoms. It's often called the silent thief of sight, okay? And so the reason is because as these nerve fibers in the optic nerve start to drop out, you know, it causes changes in the nerves, and it causes the information transmitted from the eye to the brain to be interrupted.
So what do we see or not see is the case?
The first thing is that 50% of your nerve can be damaged according to clinical studies before you even notice a visual symptom, okay? But beyond that point, patients start noticing deficits in their field of vision, specifically their peripheral vision. patients who progressively have glaucoma at the end stage, they tend to have what we call tunnel vision. So their peripheral vision diminishes to a point where they're looking through a small...
It's almost like they're looking through a tube.
Exactly,
okay.
exactly.
And can that be arrested?
Yeah,
treated?
so glaucoma can certainly be treated, and unfortunately, again, it's one of the diseases in the eyes that are not curable. But with treatment that involves lowering of the eye pressure to a safe level to reduce the damage to the nerve with either eye drops, laser surgery, or even actual scalpel surgery, we can reduce the pressure in the eye by improving the filtration of the eye.
And cataracts.
Okay. So cataracts are actually one of the most common eye diseases that all of us will face at some point in our life. And what a cataract is when the natural lens of the eye that was once clear and healthy when we're young becomes cloudy and hazy when we get a little older.
Almost like a windshield.
Exactly.
When it's foggy or
exactly.
rainy.
So
Okay.
imagine the lens of your camera becoming fogged up or scratched or hazy, and it's not really easy to take a picture with a camera that has a cloudy lens.
So is surgery the first treatment modality for cataracts?
Sure. So the first treatment is always to see, are we able to get this patient to see better with eyeglasses?
Okay.
So a lot of times that'll sort of be the first treatment. And certainly when I see patients with cataracts, what we always discuss is, okay, are you able to see well enough, or is it starting to affect your daily lifestyle, your career? Are you scared to drive at night? That's one of the biggest problems with cataracts, because oncoming headlights cause glare and halos, and certainly it can be a very frightening situation.
So of all, you mentioned all three, macular degeneration, glaucoma, and cataracts, all can be treated.
Absolutely.
But we have to be proactive.
Yes.
And get eye exams.
Absolutely.
So you can't just sit and hope is not a strategy, basically.
Sure.
Are any of these inherited?
Yeah, absolutely. So, you know, glaucoma is certainly a disease where ask your mom and dad, ask your brothers and sisters, hey, you know, are you taking any eye drops for glaucoma? Do we have any relatives who've had blindness in the family? And that's always a great way to know whether you should be proactive, you know, or have more of a reason to go and see your ophthalmologist. Macular degeneration also, we're doing a lot of genetic testing on patients now who may have a variant that can cause them to have a more severe form.
Okay. Dr. Patel, thank you very much for kind of giving us the difference between ophthalmologists and optometry and defining those three most commonly seen diseases of the eye.
Well, I appreciate you having me, Annette.
Okay. We will be back right after this. Thomas Stoliker suffered from cataracts and is here to share his story. He is a patient of Dr. Patel's and, from what I can tell, one of his biggest fans.
Yes,
So
I am.
Tell us your story, Thomas. When did you start noticing that something wasn't right with your vision, and what did you start noticing?
It was about 6 months ago, just sitting on the back porch watching TV. My right eye was very cloudy.
Okay.
And the TV, I couldn't read the captions on the TV, and I just decided it was time to get my eyes examined again. It was about the yearly exam time anyway, so I did.
Was this something that happened gradually, or you're watching TV and you're going, what's going on here?
No, it's been happening gradually. They've been watching the cataract for probably a year and a half now. And then it just all of a sudden, within the last 6 months, got really bad to where I couldn't see. If I covered my left eye, I couldn't see much of anything but a blur out of my right eye.
So what was your treatment like? You know, because there may be someone watching who's going, yeah, I don't want anybody, I know I can't see, but I don't want anybody messing around with my eyes.
Well, that was my problem. I was very apprehensive until I sat and talked to Dr. Patel.
Okay.
And he put me at such ease. I mean, I just had no question about having it done. I was going to do it, and as soon as he could do it, I was ready to do it.
So what was that process like for you?
It was very simple. I just went to the hospital and got ready to have the operation. I was in the hospital maybe 15, 20 minutes, getting all prepped up to go. And I don't think the operation took more than 10 minutes at the most. And I was awake during the whole operation.
You were awake?
Yeah,
okay.
But you don't really realize, you know, I saw them put a piece of cloth over my eye, and then that's pretty much the last I remembered, you know, until I was all done with the surgery.
And how soon did you notice a difference in your vision?
As soon as they wheeled me back to recovery, I could see a big difference. I could read the board
that
behind.
quickly?
Yes, I could read the board behind the girls that were sitting out in front of me.
Wow.
Yeah.
So what was your recovery time like?
I'm just fine now. I mean, there was no recovery time. The only problem I was having was remembering to put the eye drops in.
Okay.
That was the only problem.
Now, had there been a history of eye problems or cataracts in your family before?
No, not really. No.
This was just something that happened gradually.
Right.
So what would you say to people who are just saying, I'll just live through it, I'll deal with it, I've got my glasses, there's no point in doing that? What would you say to somebody who's sitting there going, I don't know, maybe that's just his situation, mine might be different?
Don't just live through it. Everything looks so much better when you're done. I mean, the sky is so much bluer than I have ever realized how blue it was. Everything is just so much clearer now. I was about ready to buy all new TVs for the house. Now the TVs are fine. It was me.
Because you thought your vision was messed up.
It was that bad, yeah.
Okay,
yeah.
So now, are you going to have surgery on the other eye?
I already did.
How's your vision?
I already had surgery on the other eye. I waited 1 week between surgeries, and the other eye is every bit as good as this eye, yes.
So what about family members? Are you kind of like, you know, a zealot now? You've got to get your eyes checked.
Yes, you got to get your eye. And my wife is looking into the cataract surgery now herself. Yeah.
Were you apprehensive at all? I know you wanted to make sure you saw clearly, but...
In the beginning, I was very apprehensive because I didn't want anybody to take a knife to my eye. But after I got done talking to Dr. Patel, I mean, I was just so confident in everything that he had said to me.
Have you ever worn glasses before?
Oh, practically all my life.
Okay. How religious were you about getting your eye exams before this situation?
It was a yearly. We went every year.
Okay.
Yeah, we did. We went every year to get our eyes examined. And they've been watching my eyes over the years for the cataracts.
So within a 1 week period, you were back to almost, what, 20/20 vision?
Within a week, I was back to 20/20 in the right eye, and I don't remember what the left eye is. I think it was 20/30, but I'm not positive.
Okay. Well, just in talking to you, you seem so bubbly. And
I just could not believe the difference. I just could not believe the difference. Don't put it off. If you have a problem, take care of it.
Well, I think that should be the last word.
Okay.
And he's got beautiful baby blues to prove it.
Yes, my wife says my eyes sparkle again.
Okay, good. Well, congratulations.
Well, thank you.
And we will be back right after this. It's a big, beautiful world out there with lots to see, and we want you to see all of it. Hopefully today you've learned that taking care of your eye health is not something you should take for granted. Thanks for joining us on this edition of Healthy Connections. I'm Annetta Wilson. We'll see you next time.